Management of blood-thinning medicines. Warfarin, also known as Coumadin, is the most common medicine used to prevent blood clots. It is used both for patients in the hospital and for people who may develop blood clots because of genetic or other health reasons. Despite its usefulness, warfarin may affect people differently, and patients need to be watched closely to make sure each dose is working safely.
We monitor a level called an international normalized ratio, or an INR, and there's a specific range that we want for most of our Coumadin patients, anywhere from 2 to 3 or 2.5 to 3.5, depending on the indication. And it has been shown that if that level is greater than 4, there's a substantial increased risk of bleeding. If that level is less than 1.7, there's a substantially increased risk of clotting. So there's a tight range that we want to keep it in for the safety of our patients, because we don't want bleeding and we don't want clotting. Our hospital has determined that the best way to do this was to develop a pharmacy-driven anticoagulation program. So we have a pharmacist that monitors every single patient that gets medications like warfarin. We go through and we have a protocol that we developed, and we use that protocol to see what doses those patients that we would expect them to need, and then we go through and monitor their blood levels and adjust every day to make sure they're actually getting the correct dose. Warfarin is considered a high-risk medication, so our hospital and health system has taken steps to ensure the safety of our patients when they're getting warfarin. Many different factors can affect the way people respond to warfarin. Their age, their liver function, different foods that they eat, other disease states that they have. There's many things that come into play, drug interactions, and so those type of things need to be considered with each patient individualized to make sure that they're getting the correct dose and a safe therapy for them. The way we developed this program, we had a rapid action team that came together. The team was made up of administration, physicians, pharmacists, nursing, people from information systems that were able to help us develop forms and things through our computer that we could use for monitoring. We all met together for many months in a row, and we developed a protocol that we felt really made warfarin a safer medication for our patients.
Data-driven guidelines for hospital patients on warfarin. Evaluate patients and decide level of risk for forming blood clots. Start medication based on risk level. Adjust dose within hospital depending on blood tests. Give patients special instructions when they leave the hospital. Reason for being on blood-thinning medicine. INR goal levels. Timeline for how long medicine is needed. Copies of blood tests and dosage amounts given in the hospital. Prescription information for taking medicine at home. Appointment date for follow-up. General information about warfarin. After patients go home, their INR levels still need to be checked often. To make this easier, special Coumadin clinics are available at all ISJ clinic locations.
So what are the benefits of the Coumadin clinic? Well, it provides consistent, safe care. And how does it do that? In the past, the patient had to go to the lab and get their blood drawn out of their arm, and then they go home. Then they had to wait at home to find out the results. The doctor might be waiting for the results too. He might be in surgery, he might be off that day, and where does the lab go? These are all points of vulnerability for safe Coumadin delivery. Then the doctor would adjust the dose, and the nurse would be calling the patient with the results. So what happens if the patient isn't home? Let's say that the blood was too thin and the doctor decides that this patient shouldn't take their Coumadin that night. Maybe the patient decided to go to her sister's, took her medicine with her, and is going to take a dose of Coumadin that night, not knowing that her blood levels were high and her blood was too thin. So that is another point of vulnerability for the patient. What if they don't understand the instructions very clearly? We all have different levels of understanding, we have different levels of hearing. That's another point of vulnerability. What about diet changes? Has anybody asked them about the diet changes and some of the things that Jody discussed? These are all points of vulnerability that we can eliminate by having them come to the Coumadin clinic.
Coumadin clinics make it easier for patients to check their INR blood levels and adjust medication on the spot. Finger prick for blood sample. Review health or lifestyle changes. Check dose history. Review blood tests and health information. Adjust medicine dose if needed. Set up next appointment.
The great thing about this is we're including the patient, so they're part of their own care. They get to know exactly why they're on it, they get to understand how the medication works, and that it is a high-risk medication and it's something that they will need specific monitoring for so that they know when they go home not to miss those appointments.
There's a lot of patients that don't know until they come and have this education that if they even miss one dose, that's going to make a difference in adjusting their Coumadin level. But if we talk about it, the patients sometimes now come in and say, oh, you know what, I'm sorry I missed a dose. Well then, the provider or the RN is not going to over-adjust the dose. So it's a really nice safety net for the patient. We can offer to our patients safe, effective, quality care through our system-wide anticoagulation program, starting from inpatient and going all the way out to outpatient.
After the guidelines of warfarin management were developed and implemented at Emmanuel St. Joseph's, the entire Mayo Health system did adapt our same protocol. Springfield and Waseca both have pharmacists in place as well that follow this protocol and provide the same care for their patients. And during their off hours and on weekends, Emmanuel St. Joseph's pharmacists do cover for that health systems. So those patients are getting the same monitoring 24 hours a day. It's just another way that the system is just working together to provide the same care for everyone within our system.